Hi, everyone, and welcome to our MLP COVID-19 Town Hall. My name is Danielle, and I'll be running tech on this webinar today. In just a moment, I'll turn over this presentation to our panelists, but before that, I have a few housekeeping items I'd like to go over with everybody. Everyone is joined and muted. At the end of the presentation, if you do have questions, please send those in the chat box once we get to the Q&A section. And if you encounter technical difficulties, don't worry, this webinar will be recorded and will be made available on our website, which will be shared on the chat box as well. And now I will hand it over to our first panelist, Mallory.
Okay, can you hear me?
Yes, we can hear you.
Okay, great. And actually, I'm going to have Ellen walk us through the first couple of slides. So Ellen, if you can talk through the slides here at the beginning, then I'll jump in with mine.
Great, thanks Mallory, and greetings everyone, and thank you Danielle, and thanks to our amazing group of panelists who are joining us today, and all of you out there. We're in the midst of a national emergency, and we have a lot to talk about today, and we also have a great opportunity to connect, and so I'm very appreciative of the panelists who are joining us today and all of you who are taking time out to ask us questions, participate today, and think with us about how we can respond to what's happening in our communities and nationally. And so our topics for today, as we circulated in our email, coordinating health and legal efforts during this pandemic, navigating MLP operational challenges, and the ongoing work nationally to prevent evictions during the pandemic as a focus for today. Next slide. And let's just all take a moment here, saying for myself and for all of us to just take a deep breath. So we can spend this time together and support each other, professionally and personally. Next slide, please. I, again, really appreciate the contributions, and you'll get to hear from these wonderful leaders over the next hour. And what we're going to be doing is moving through giving each participant, each panelist, 5 or 6 minutes to talk about what's happening from their particular vantage point. Some have slides, some do not. Some have resources, some have suggestions, and are here to answer your questions. And so, again, appreciate very much their contributions. And I want you to think of this as really the first effort that we're putting together in terms of reaching out, supporting you, sharing best practices, current practices, evolving practices, so that we can continue our conversation about this work together. Next slide. We collected a little bit of data from you, and so right now I think we've got about 200 plus people on this call. I would say about half of you are from legal services. We have some folks from health centers and hospitals, also from law schools, and then from public health departments, and some national associations like NLADA, LSC, NAC, and others. So we appreciate you being here. Next slide. You shared with us during registration things that you're concerned about, and we shared those comments back with all the panelists, and they fell into roughly 5 buckets, and that is concerns and thinking about examples of how to perform remote legal work, MLP fundamentals, like connecting with your healthcare providers during this time, different populations and how COVID-19 is affecting those populations, then COVID-19 specific topics like discrimination, advocacy around PPE, and rationing care. And then finally, general concern about clients, providers, our own stress levels, funding, and the future in general. And so we've got a lot of ground to cover. Like I said, this is our first opportunity to convene folks. And please, if we don't get to your question, know that we are going to be tracking questions, tracking what comes in through the chat. The chat goes directly to Danielle. She and I are going to be sorting out the questions. Our lineup of speakers is going to go to Mallory, and then to Keegan, and then we'll hear from Emily, and then we'll hear from a great team at Network for Public Health Law, Donna, Levin, and Kerri Lowrey, and then we'll move to Randye Retkin, who's in New York at LegalHealth, and we'll share some current active best practices that are happening there. And then we'll move into Q&A, but again, I think we have the opportunity to hear from these experts, their reflections, and so we have an opportunity to extend beyond the 2 o'clock hour if need be, but we also want to be mindful of folks' time and commitment. So with that, I'm going to hand it over to Mallory to kick it off, and I'll be monitoring the chat for your questions and comments as we go. Mallory, take it away. Thanks.
Hi, everybody. I'm Mallory Curran, and I've been involved in medical legal partnership for about the last 20 years. So I know many of you. For those of you I don't know, I'm so pleased to meet you through this web conference, and just really pleased to have our community come together. Thank you to the National Center for organizing us. My contact information is there. I was a MLP attorney in Cleveland and New York City for many years, and for the last 5 years or so, I've been consulting and had the privilege and joy to work with medical legal partnerships across the country. Those of you who have seen me do presentations before know that I love public art. I love murals in particular. You've probably seen me share this mural before because I love it so much. As we get started, I just kind of want to ground us in why are we here. We are here because we believe that we all deserve a healthy and safe community. And because we believe that we're stronger together than we are apart. So whether you're a healthcare person, a public health person, a legal services person, or otherwise, you know that we all have a crucial role to play in the health of our community, and that's true today now more than ever. This crisis is it's a test of our resolve. It's a test of our institutions, and it's a test of our humanity. I have a lot of love for this MLP community, and I have a lot of faith in this MLP community. As I said, MLP now more than ever, and I firmly believe that we have the relationships, we have the structures, we have the skills, and right now, probably more importantly, we have the creativity and the flexibility to respond to this crisis. So I'm glad that Ellen had us take a breath. That's incredibly important, and like taking a moment to sort of reflect, where are we and where do we want to go? I'm going to start off by talking a little bit about remote legal services and telehealth. Another hat that I wear as a consultant is working with legal and healthcare entities on technology, primarily on the legal side, just a tiny bit on the health IT side. A couple of things, I'm going to breeze through these slides, and I'm going to be pasting the links for you after I'm finished speaking. So just resources for those of you who have gone from working in an office to working at home in probably the space of around 24 hours. If you're not already on the legal side, if you're not already a member of the Legal Services National Technology Assistance Project email list, I strongly recommend that you go to their website and join it. There has been a ton of conversation over the last week or so about how to immediately convert your team into a remote team. So you can get it as a digest. It just comes in once a day. And then also, I encourage you to go back and look in the archive. People have been talking about hardware, software, electronic signatures, faxing, mailing, alternatives to using personal phones for work, remote working policies, virtual notaries, all kinds of things that you are worried about. Of course, everyone is worried about across the country. So if you're not connected through this email list, I strongly recommend that you become connected. Also, they have a webinar coming up on Thursday that's about remote work and remote legal services. So I'll put that registration link in the chat here. Also, the Asylum Seeker Advocacy Project has a really great document on best practices for providing legal aid and working remotely. They are and always have been 100% remote. Their clients are all over the United States and elsewhere. I will put the link to this document in. I encourage you to review it. Also, our colleagues over at Pro Bono Net quite timely put out a guide for nonprofit and pro bono innovation with respect to providing remote legal support. So I will also put a link to where you can find that, or you can just Google that. It's in a couple of different places, and I also encourage you to download that one. On the side of telehealth, I went to our colleagues at the National Association for Community Health Center, NAC. Of course, they're on top of it. They have webinars, they have toolkits, they have materials. Whether or not you are at a health center, I encourage you to view NAC as an important resource in the midst of this crisis. And I also want to share, I was talking with a friend who's a physician at a health center that's associated with a larger sort of big name health institution. And no surprise to many of the people on the call is that the health center is doing a lot better. They were able to pivot, they're doing telehealth, and they're really in advance of their colleagues at the fancy big name health institution. So don't make assumptions about who's able to pivot quickly and who's not. If you're working with some big name folks, they may need your help and insights in how to do this and how to do a better job. In the health center realm, most of us, we're really used to making do with not enough. And I think that that has put us in a better position to respond to a situation where there's a lot to do and only limited resources. Okay, a couple of things about, and again, I'm going to put all those links in, a couple of things about MLP Fundamentals. Actually, I'm going to take one step back. If people are interested in having a broader conversation about working remotely and providing remote services, give that feedback, and that's something that we can put together. Okay, so now on to MLP Fundamentals. I encourage you to think about this in the framework of a disaster, right? We are in the midst of a capital D disaster, and there are a lot of parallels to natural disasters, hurricanes, wildfires, flooding. And so we have the opportunity here to learn from our colleagues, some of you are on the phone, who have been through very significant natural disasters and can help us think through our approach to what's happening. So on the screen there, you can see there's a report from the Legal Services Corporation with a bunch of good information and recommendations. I wanted to flash this up so that people can start thinking about this life cycle of civil legal issues in a disaster. So of course, this is not going to apply perfectly, but I think there's a lot of overlap to what we're experiencing now, to what has been experienced in natural disasters. So I think we all need to be thinking in terms of our short-term response, what is happening right now, and what do we anticipate happening over the next month to 6 weeks. 2 months, we're remaining flexible. Then what's our medium-term response going to be for the issues that we're anticipating seeing in the next 1 to 6 months after things start hopefully slowing down and we can start to go back to our new normal. And then also, these long-term impacts, we're going to be working on these cases for a long time, for years. And so thinking about your response, I think in short term, medium term, and long term is a wise way to go. And also, of course, some of these issues like, repair to your house, post-flooding or those kinds of things aren't going to apply. Other issues are maybe going to be even more important: health insurance, custody-related issues, education issues, in particular for students with disabilities, and so on. But I think this will give you, as I say, a framework to kind of move forward. Okay, so I know that you're already asking yourselves, like, what can I do right now? And I have some thoughts on that. And then those in the field, Keegan and Randye, can sort of speak to whether I'm getting this right or not quite right, or the experience is one place and another. The answer to what can you do right now is really going to depend a lot on where you are in terms of the crisis. So what Randye's going to talk about in New York City is not going to be the same thing as what's happening for Keegan in Austin. What's happening in Houston may not be the same thing that's happening in Montana. But there are some simple things you can do if you're not, in the midst of a huge crisis. My colleagues at my home MLP in Cleveland, you can see the legal aid just put a shout out to Metro Health, which is their earliest partner. And Metro Health is like, thanks. Standing together while standing apart is what we do, right? So just sort of affirming your partnerships, that's super simple. Then I'm going to say, I think you're going to be letting, if you're a legal team, you're going to let the healthcare partners lead your immediate response. And again, the healthcare teams, I'm really encouraging to reach out to your legal partners. What are your concerns? What can they do for you? What answers do you want them to provide to you? And then also, I encourage you to think not just about the immediate crisis, but the medium and longer term issues. So there are some people on your staff who are able to think a few months ahead. The answer may be no, and that's fine. From the legal teams, what you hear back from your healthcare partner is going to depend on the strength and the depth of the relationship that you have with your healthcare partner. And so you may need to give them space, whether your relationship is strong or not. They may need space right now. They may not be able to respond to you when you reach out. You need to acknowledge it's okay if you don't get back to us. We want you to know that we're here. And you may really want to offer some specifics about what you have to offer to them, so that you can say, rather than like, what do you need? Let us know. Reach out to them like, here are 3 things we're thinking that might be helpful to you. Respond when you can. And then also something that Emily is really going to be focusing on is, I think now is really a key time to consider shifting your resources from direct client services to broader-based advocacy, especially in the immediate term where we are right now. Policy advocacy, administrative advocacy, legislative advocacy, really community-wide advocacy at the local, state, and national level. You also could be thinking within the healthcare institution about processes and systems, and then also keeping the relevant healthcare staff up to date on current relevant local developments about what's happening that's relevant both to their patients, but of course also to their employees. The next thing I think you can do right now is to prepare for what's coming in the months to come. What are you going to need to do to train healthcare staff in the medium term? What will you need to do to reach patient clients in the medium and long term? How can you expand your capacity beyond individual advocacy? So thinking about, can you leverage the electronic health record with letters and templates and so on to resolve some issues that we know are going to be common? And then also, I'll just say a couple of things about funding healthcare teams. Can you earmark funds now and in the future to support your legal team supporting your patients in the medium and the long term, as well as in the current? Think about your MLP as a stakeholder. Similarly, on the legal teams, think about, go to your organization's leadership and make sure that they think of your MLP as a key stakeholder in what is going to be a very long disaster response in your community. Last things I'm going to say before I turn it back over. In the general concerns area, this is a marathon. This is not a sprint. That's why taking a breath is even more important to center yourself and get your thinking organized, again, about how you're going to respond in the short term, the medium term, and the long term. It's very important to take care of yourself and your family and those that you work with. And then just last thoughts about crisis leadership. From my perspective, honesty is incredibly important. What do you know? What do you not know? Being transparent about how decisions are being made. It's so important to bring in diverse voices to come up with strategies for resolving what are going to be very complex, profound issues. And then over-communicate. Even if you're saying, I don't have any new information than what I had yesterday, it's important to communicate very regularly so that everybody feels like they're in the loop. And then lastly, just keep your core mission front and center. This is what should guide your decisions about what you're doing in the short, medium, and long term. Focus on who you are and what you do best. And before I turn it over to Keegan, I want to say thank you to all of you on the call. We need strong institutions now more than ever, and you're all essential threads in the fabric of your communities, and I thank you all for your service. And Keegan, over to you.
Thank you, Mallory. We are fortunate because our legal partner has provided remote legal services since the late 80s, and they have continually prioritized developing telephonic and web-based services in order to serve the 254 counties that make up Texas. So from that perspective, our transition has been it hasn't been as challenging as it may be for other entities. That means that we're able to use telephonic services, that we're looking at web-based services. We already provided chat services, for instance, also at our legal partner. So on the medical side, our MLPs include several medical partners, and they have responded in varying ways, and that's meant that we need to have a flexible response and really try to match what they're doing, as always, right? So we've seen peaks and especially valleys. There are days where we're not getting referrals where we used to, but we also feel that is an opportunity to work actively on the cases that we already have open, but also to really emphasize the opportunities that lie within medical legal partnership for addressing not just those kind of midstream individual socio-legal needs of patients and families, but also to think systemically, right? It's no accident that our justice system, our judicial processes are very much an active part of the response to COVID-19. So at all of our active sites, the referrals come in through the electronic health record, and so we have, as we transition to working remotely, we've just brought that service with us. Our phones are twinned both through law firm numbers and through the medical side. We also use software like Microsoft Teams in order to provide curbside consultations. And it turns out that's been one of the greatest opportunities at this time, is to help staff be able to understand the plethora of responses, changes within the judicial system, changes in terms of access to systems. We've really been able to assist with that. We've also been able to take advantage of the fact that although we're working from home, there are still healthcare workers on site. And so they've really been able to assist with exchanging paperwork, for instance, with existing clients, so that we're not endangering anyone or taking more risks than are necessary. So I mentioned that we've seen an uptick in curbside consultations. That's also been by email. We've, as I mentioned, also really worked on helping staff and patients understand the systemic, the changes within our judicial system. And then finally, most excitingly for us as practitioners, has been that this has been a great time to really be consistent in terms of unsiloing practices and our unsiloing responses. So our MLP led efforts to draft an emergency rulemaking petition that both our medical and our legal organization signed on to. And that emergency rulemaking petition asked for a statewide directive concerning utility protection, and it was successful. So I think the power of medical legal partnership is more evident than ever, and that we can do this on a systemic level, an organizational level, and think about ways that we can multiply our individual responses outside of our individual profession. And then as a final note, just to follow up on what Mallory said regarding funding, I think this is a great time to be proactive in requesting flexibility regarding grants and philanthropy and the like. Our legal organization has really been very strong in that way, because we anticipate that there will be new legal needs, new health harming legal needs that emerge from this crisis. And so we're optimistic that our core mission to increase access to justice in a way that facilitates positive health outcomes remains strong, and that this is an opportunity for our MLPs to be part of that mainstream response on both the medical and legal side.
Great, thank you, Keegan.
Yeah.
Oh, sorry, go ahead, Keegan.
Oh no, I was just actually going to turn it back over to you to move on to the next person.
Okay, great. And I'm going to go ahead. Oops, I pulled up the wrong PowerPoint. So Emily, if you can get started, I'll get you going here in a moment.
No problem. Thank you. So the vast majority of patients served in the medical legal partnership setting are especially vulnerable to COVID-19, and as we all know, will be hardest hit by this pandemic. Even before this crisis, these patients experience toxic stress, chronic disabilities and conditions, and trauma, and were likely to be choosing between necessities and paying the rent. Today, that choice is a matter of life and death. If your clients lose their housing, they will have a greater chance of exposure to COVID-19, and where they have chronic disease or disability, an increased COVID-19 mortality risk. The next slide, please. Fortunately, state and local courts and governments are recognizing that housing is health, especially during a pandemic, that they are one and the same. As exemplified in the findings of this New Jersey emergency declaration, decision makers across the country understand that housing security and stability are critical to the public health, and that eviction, foreclosure, and homelessness increase the risk of COVID-19 contraction throughout the community. Next slide, please. Across the country, states and localities are freezing evictions, and MLPs have been at the forefront of change. However, the moratoriums are not uniform, and some of them are more protective than others. 16 states currently suspend the execution of past orders of eviction that occurred prior to the pandemic. 31 states have suspended eviction cases, and 10 states have suspended civil cases, which should include eviction. 8 states have left the discretion to local courts, and 5 states require tenants to prove that non-payment of rent is related to COVID-19 or other financial hardship, which essentially nulls that moratorium because it will be too challenging to prove. And 5 territories have no order in place. Some states have also explicitly halted foreclosure as well as utility shutoff. Some things to note in the nationwide moratoria. Not every state or community has frozen every stage of the eviction process, from filing of the execution to the actual eviction. Some states still allow online filing, and others are holding remote hearings, even for evictions. The majority of courts use declarations instead of notarized affidavits in both criminal and civil cases, and the states often have an online notary public act that is now in effect. Even where cases have been suspended, courts are still remaining open for emergencies, and this is important for our clients because emergencies should include protective orders, lockouts, and life-threatening conditions in the home. Individuals who are homeless and victims of domestic partner abuse are encouraged to seek shelter. People who are homeless are exempt from all of the stay-at-home orders. However, not every state has actually created additional shelter or safe spaces for these individuals. You can learn exactly what is being suspended in your state, district, and county on local government and court websites. And in addition, the link at the top of your screen in the slide includes national information and is being updated daily. MLPs can and should be at the forefront of both defining and demanding eviction moratoriums, utility shutoff freezes, and foreclosure moratoriums, much like you'll hear from Randye Retkin at LegalHealth, how they were so influential in New York City in achieving great outcomes. Next slide, please. Now, filling some of the gaps at the state level, fortunately, the Federal CARES Act eviction moratorium is now in effect as of March 27th, and it covers the vast majority of rental housing in the country. For example, HUD programs alone, which are just a fraction of what's covered under the CARES Act, apply to 10.4 million people and house 5.2 million households in the country. For covered properties, it bars the filing of any eviction case for non-payment of rent for 120 days, which is July 25th, and thereafter it requires a 30-day notice before an eviction can be processed. It applies to VAWA covered housing programs, which, using that term, was presumably the quickest way to capture housing, all housing administered by HUD, the Department of Agriculture, the Department of Treasury. In addition, it also applies to the Rural Housing Voucher Program, federally backed mortgage loan programs, which is 1 to 4 units, and federally backed multifamily mortgage programs, which is 5 or more units. In addition, we also have a federal 6-month foreclosure forbearance. The National Housing Law Project advises that because the scope of covered properties is extremely large, there's almost no mortgage in the country that does not have some nexus with federal support. Advocates should assert that the tenant is protected by the moratorium and assert that a landlord who files an eviction suit for non-payment of rent must prove that the property is not subject to federally backed mortgage loan or housing program. Next slide. Oh, and I should mention, you can check the preservation housing database to determine whether or not your client's home is part of a federally assisted program. And we'll include that link. So in many communities across the country, a visit to the emergency department means exposure to COVID-19. We need to keep our patients and our clients housed in safe and healthy housing. How do we do that? Well, this is not an exhaustive list, but it's a start. First, we must protect our patients' ability to safely shelter in place by securing rights under federal and state eviction and utility shutoff moratoriums. Where the state has an eviction freeze, the Attorney General may be able to enforce it, and that should be explored. And where there is no utility shutoff freeze, you might be able to exercise medical exemptions under this pandemic. At the same time, we know that low-income tenants often reside in substandard housing that has mold, infestations, and other hazards that could increase asthma and respiratory distress, the need for emergency care, as well as COVID-19 mortality risk. Under a shelter-in-place order, dangerous conditions should qualify as emergency public health inspections being mandatory and emergency injunctive relief. If not, that's something to immediately advocate for as being part of these protective orders. Second, in order to access the stimulus funding and direct it to the populations hardest hit, MLPs are uniquely situated and will need to track patients' needs. We need to determine what supports your clients will need post-pandemic as well as during the pandemic and collect that data to make the case for resource allocation. Not one state has released a plan for how to handle the avalanche of eviction cases when the moratoriums are lifted, let alone how to provide tenants with rent relief, protection against further eviction, and income supports and more. MLPs are well situated to be at the forefront of that decision making. So as much as possible, keep track of unemployment, housing conditions, access to necessities, risk of eviction post-pandemic, as well as any infringement on the client's rights, because we know that our patients and clients are the most likely to have their rights abused during times of stress and pandemics. These can be used to direct the recovery response. Third, leverage pro bono resources. Ask pro bono partners to determine how the stimulus funding is being dispersed in your state and to simplify how clients can file for or take advantage of programs. Determine if your state has taken full advantage of federal waivers and resources from the federal government. For example, while the majority of states have applied and received waivers for the free school meal programs, only a quarter of states, have applied for the pandemic EBT funds that are available. Pro bono partners can help you find out where your state stands and who can advocate for more resources for your clients. Where your state lacks a model eviction moratorium or is yet to adopt one, pro bono counsel can compare emergency powers by state and present models. For example, Illinois and Maine have the exact same statutory language in a pandemic, but only Illinois used that language to freeze execution of evictions during the pandemic. So that can be a model that Maine can use to try and advocate for additional protections, for example. Partners can also develop template letters to landlords and employers. And tech and design companies, like Mallory mentioned earlier, how important that is. Some like Just Fix, for example, can develop apps and mobile resources for easy communication to clients and to disperse know your rights information and sample letters. And also law students. Law students across the country, thousands, have signed up to help through the Law Student COVID-19 Pro Bono Response Network. Use them. They can check in on patients. They can train patients on their rights, and they can conduct legal research. Ultimately, MLPs are critical to securing the health and safety of our patients and of their housing. And this is what our patients need to survive this pandemic. You were already shouldering enormous weights before the pandemic that have since grown beyond measure. Thank you for your heroic effort to protect clients and to ensure that the future, the society that we return to, is one in which health justice is realized. Thank you.
Thank you so much, Emily. And let's turn it over to our colleagues at the Network for Public Health Law.
Hi everybody. This is Donna Levin. I'm going to start off for the network. be followed by my colleague, Kerri Lowrey. So first I want to thank you all for the opportunity to join you today. We really appreciate the work you're doing. We know about the work you're doing. We've been able to partner for the last couple of years with the National Center for Medical Legal Partnership and then some of the individual MLPs across the country. So we are the Network for Public Health Law. For those who don't know us, we are a group of lawyers across the country in 5 regions, and we are primarily funded by the Robert Wood Johnson Foundation. I mention that because through that funding, we're able to provide no-cost legal TA and resources on public health authority and all public health legal issues under the sun, and again, free of charge. So we are here and have, with our grounding in public health, this being a public health emergency, a lot of resources we can share with you and real-time guidance through TA. So on this slide, let me start there. If you go to our webpage, you're going to land on this COVID-19 slide, and it will take you to various resources that we have on the web and a way to connect with us. So if you see that box on the top right, in the top right, the left-hand box, how can we help? If you go to that and click on it and then go to the bottom, you're going to find a very quick way to just get your question in, say who you are, get your question in. It will be triaged really fast. And you can also find a box there at the bottom that will get you the email or a call-in number for every attorney in every region. So, and they in turn will be able to, if they can't answer your question, we'll triage that to someone who can. So if you go to the next slide, please. So here you'll just see, I think this gives you an idea of the kind of real-time help that we've been trying to provide. We've had exceedingly well-attended webinars on various issues that have come up. So anything from back from, I think, starting February 6th, state and local government issues that have come up, real-time issues on preparedness. I recently did one last week on crisis standards of care. That's what people talk about when they talk about the allocation of resources and unfortunately where the healthcare system is finding itself these days in hospitals. We have one coming up on data sharing, which are quite a lot of issues coming up on that, coming our way on that. And then back to state and local government actions. There are constitutional issues that I'm sure as lawyers, the lawyers in the audience are aware of that seem to come more to the surface this weekend of somewhat in abeyance, but we're going to be ready, I think, in a couple of weeks to see where we stand on those issues. So I also just wanted to mention that the webinars are 30 minutes of us presenting and then 30 minutes of questions. So we really try to leave that time for the discussion, and any TA, any questions we don't get to, we will get back to people and answer them as technical assistance questions. And there are a series of FAQs on the web site. For example, taking data again, privacy, disclosure to news media, data sharing guidance for school nurses, etc. So I'm going to go to my last slide now, please. So here you can see my wonderful colleagues who head the regions, and we've tried to separate out the areas of expertise that have to do with COVID-19 for this slide. The emergency preparedness and response in calm days and now in these pandemic days has been centered in the Western Region office with our colleague James Hodge at Arizona State University. So that said, the regions are working on related issues across each region, and going to hand it over now to Kerri, who is a deputy in our Eastern region, to talk about specifically some of the issues they're working on that we thought would be aligned right now with the focus of MLPs across the country. So, and now I'm going to hop off the web so Kerri can get.
Donna, there was a spot for me.
Sorry?
There was a spot open. There was a spot, so you can.
Oh, okay, you're on. I just can't see you. Great, go for it.
I'm sorry, Mallory, can you go back to the last slide? I had a little bit on that slide as well. Okay, so hi everyone. My name is Kerri Lowrey. I'm the Deputy Director for the Eastern Region Office. I work with Kathy Hook, who's our director. Since this pandemic hit, most of our technical assistance requests have fallen into these categories. The moratoria on evictions and water and utility shutoffs. I wrote a blog on that early in March, and since then we've been closely watching these policies develop, relying very heavily on Emily's work. So Emily, thank you for really pulling the heavy weight on tracking those. While Maryland is one of the states that requires tenants to prove their ability to pay rent, their inability to pay rent is due to COVID-19, the courts have closed in the state, and they announced that they will not hear failure to pay rent cases during the state of emergency. Maryland Court of Appeals also stayed all pending home eviction orders and foreclosures in the state. So that is one small victory for our state. We also do provide free quick hit legal assistance to Prince George's County Community Schools here in Maryland. I had a school representative contact me saying that they have a number of families that cohabitate in kind of informal, unwritten lease arrangements. So there's a master tenant and then some subtenants who do not have actual written leases. And a number of these people were getting threatened that, you need to pay us rent, you need to pay your rent. So I did, we wrote a letter for them to give to their master tenant, basically saying that because of the governor's executive orders, they cannot demand rent during the state of emergency. And because many of these subtenants are undocumented, we also explained that these protections under the executive orders extend to everyone, regardless of immigration status. So that's been one, we've given out like 4 or 5 of these letters just since last week. Another issue is students' food access during school closure. And one of my colleagues in the Eastern region, Matt Swinburne, has been working with a group of law students on this issue. They're writing an issue brief that looks at federal nutrition programs that help to feed food insecure children when they're not in school. Several of these programs can be activated during unexpected school closures like this pandemic. And Matt also prepared a 3-page resource sheet on the Family First Coronavirus Response Act, which has several provisions that adapt the major federal nutrition programs so they can better respond to the food security needs of vulnerable citizens during the pandemic. And finally, well, not really finally, but here's the other big one, has been student privacy and COVID-19. We've handled a lot of technical assistance requests for school nurses and schools regarding sharing of student health data during the pandemic. So, can they share, and how can they share test results of positive staff and students with health departments and other officials? What does the exemption look like under FERPA, which is the federal law that they fall under? Can they share positive results with parents and the rest of the school community and the media and those kinds of questions? Okay, Mallory, next slide. Thank you. And finally, we did want to highlight the judicial trends. We've been following for the last several months major developments in public health judiciary decisions. And we decided, because there are so many challenges that are happening across the country, to focus our next issue, which will come out in April, on COVID-19 lawsuits. And so I just wanted to highlight a few of those for you. We're going to start seeing a lot of constitutional challenges. We already are. One of them was a case in New Hampshire. 3 New Hampshire individuals filed a lawsuit alleging that they have the right to assemble a day after Governor Sununu prohibited gatherings of more than 50 people. The constitutional challenge argues that the governor's order is akin to martial law, infringes on their federal and state constitutional freedoms to assemble and freedom of religion. We'll be carefully tracking these constitutional challenges, as I mentioned. Another case that is of interest is there was a class action lawsuit that was filed in federal court accusing the owner company of Purell for making misleading statements about its product, specifically that it can, quote, prevent 99.9% of illness-causing germs. So we're tracking that one and seeing how that plays out. And also, interestingly, for owners of small businesses, there's a case in New Orleans right now from a restaurant that's suing its insurer for declaratory judgment that the restaurant is entitled to insurance coverage for business interruption due to the pandemic. We'll likely see a lot of these challenges of insurance from small businesses as well. And finally, there are a lot of these cases related to prisoners and their unique risk of contagion being in prisons. And the Legal Aid Society and the Bronx Defenders in New York filed a lawsuit against the U.S. Immigration and Customs and Enforcement in federal court seeking immediate release of 7 individuals that are in immigration detention who, either by virtue of their age or their underlying medical conditions, are particularly vulnerable to illness or death if infected. And we're seeing a lot of these cases for older and sick inmates across the country as well. So with that, there are many more. I'm kind of in the interest of time and we want to be able to take questions. I'm going to pause there. But as Donna and I mentioned, our work and our research really is driven by the technical assistance requests that we receive. So if there are common legal issues that you're encountering throughout this ordeal, we want to hear from you. We can prepare products about these kinds of issues that you're seeing, even policy change that needs to happen as we identify problems with our current legal framework and make them available as a resource for others on the network's website. So thank you for your attention and I look forward to your questions.
Thank you so much. And I'm now going to turn it over to Randye Retkin from LegalHealth in New York City to talk about their on-the-ground response.
Great. Thank you very much, Mallory, and thank you all for inviting me to participate today. I only got involved with this presentation the last day or so, so it's not as if I have a whole lot of prepared remarks, but I do have a lot of thoughts and sort of feelings and some concrete advice, which we've been going through the last few weeks. You know, New York is going through just something unprecedented and, you know, trying to figure out how we help our colleagues, our healthcare colleagues, our clients, and our families all at the same time has been truly rough. It's you know, I only say that because I think that you know, all the health experts say that, you know, especially cities, it will be, you know, a significant proportion there as well. So how did we maintain and what did we do during these last few weeks? I'll just like to talk to about that a little bit. And so I'm going to move to the next slide. You know, the first thing we had to figure out is, as an MLP, is how do we continue services? We have spent, you know, we're almost 19 years old, and we have spent all our time trying to reach each healthcare professional, make as many connections as we can to get all those referrals of those important cases. And now what's happening is, at least in New York, all our connections in some ways are gone because all the healthcare professionals are being either that we deal with are being either redeployed, are teleworking themselves, or becoming ill. And so it's a matter of reinventing yourself through some kind of centralized system. And that's what we've been moving to. We have worked to have at least one of our systems, our public health system now, just with one phone number. And that's hard when your own office is going through its own technology challenges, trying to support everybody who's now working remotely. But we sort of feel that that's the only way to go because we no longer have the person on the ground making the referrals. And if you see what's happening in New York, you know that all the hospitals are becoming COVID-19 hospitals, basically, and most other services are being moved out. So you have to reinvent yourself. We have also tried to change, and I think that's been addressed by many of my colleagues on the panel, changing practice laws and regulations, everything from notarizations. We're working on ways to do healthcare proxies, expanding standby guardianship once again to include not people who are terminally ill, but anybody exposed to COVID-19 or healthcare workers especially. And that is now before our governor with an executive order. And I think that's how many of the changes that you hope to see will happen, because many state legislatures are not either in session or they're working differently. So everything has been done by executive order. Also, we're generalists, like many of you on the line. And so we practice in immigration, veterans, Social Security, debt credit, you name it. And so there is changes to everything. And so we've had to keep abreast of all those changes. And I'm grateful for the groups that were talked about earlier who actually are sort of putting this all together. And in New York, different organizations have done great jobs in sort of collating everything and making sure that there's one place to look. And that was our last social work blast. Every month we send a social work, healthcare professional blast out. And what we did was the latest closings in immigration and housing for our healthcare professionals. So keeping abreast of all that. But it's really hard because you don't really have the sort of, we haven't sent another blast out until we sort of know where people are and who's really out there to send it to. We have been hearing directly, though, from many healthcare providers, many of the frontline workers, including ED docs, who have been reaching out to us about, for example, homeless people with COVID-19 symptoms coming to the ER, then taking up a hospital bed when maybe they should be in shelters, trying to create shelter beds or isolation beds. And we've been working on advocacy. I think that's a really terrific way MLPs could play a real direct role. What do those providers need? And I think somebody, maybe Mallory, said this before, you cannot, we don't want to bother our busy healthcare providers who are saving lives right now. So we only want to reach out when we're helpful, when we really have something to say, but we really want to hear from them if they're having problems. So we're focusing on sort of the problems they're having. And finally, just on this slide, pro bono counsel. There's been some offers to actually provide that for healthcare workers. Sadly, if we've had healthcare workers wanting to do their wills, wanting to do standbys. So that's something that I think we're sort of looking into. Next slide, please. And then I just want to talk a little bit about as a role as an MLP leader or manager. This was also said, but you have to really be transparent about what's happening in your workplace. My organization has been great about telling, especially in the beginning before, there was so much community spread about, the fact that we had a case, we had 2 cases, of people who had the virus. Now it's at a different stage, and I assume in New York and other places, everybody should act like they've been exposed. But in the beginning, it was very frightening, and but I think it's so important as a sort of MLP leader to make sure that your staff feels that they have the most transparent information. And also, staff get sick. Our staff has been getting, some staff has been getting sick, and how do you support them? So we've been doing a lot of checking in all the time. We're a big group. We're over 55 people, but we have different, leaders, the supervisors, and this is true throughout my organization. Everyone is checking in on everyone else to make sure they're okay, not only physically, but mentally. And we've also, just as another thing, we've tried to keep as many systems in place that we normally had during our workday or work week, rather. Our team meeting happens at the same time, our immigration subcommittee, our veterans group, because I think part of our job is also to keep ourselves feel there's some, normal routine going on. Let's see, providing your partners with changes. I think we talked about that. You don't want to update them. You want to be very selective on what you tell your healthcare partners. And just daily check-ins with your staff. I think I mentioned that as well. And if you want to just go to the next slide.
Sure, I will in just a moment. And I just want to acknowledge that we're at the top of the hour. We're going to stay on, I would say, for at least another 15 minutes. We understand that some of you may need to go. I believe this is being recorded and will be made available. So we'll have Randye wrap up here, and then we'll transition into questions. So thanks everybody for your patience.
I just wanted to share with you our external messaging that we sent out, and we're continuing to send out, because we have lots of different hospital systems and community health clinics. So if you want to just move to the next one, please. And I put this up on the slide deck because I felt like you should use it if you'd want to. And it really talks about I just made up a hospital, and it really talks about our sort of the way we are transferring from this sort of centralized triage, that we're only taking phone intakes, obviously services are free and confidential, even on the phone. For example, we've had immigrant clients very fearful of speaking on the phone. They thought that we were immigration, because normally they're used to face-to-face, so you have to really think the differences that you will have on the phone. Also, for example, we've had clients, we don't know if they have capacity or not. Hard to determine that on the phone, so you're going to have to really think about when you move to, if you haven't already, to tell it law. If you want to move to the next one, please. And this is my last slide. It's a little small, but I think what I was trying to do here is really to talk about all the specific issues that we think we'll have to deal with during the epidemic. I know, of course, housing was clearly mentioned front and center, but we're talking about advanced planning, appeals for benefits, or recertified for benefits, housing conditions, but again, they have to be really, at least in New York, really severe housing conditions. Shelter advocacy is a big role that I think we've had to play and continue to play. We've also had cases where people are actually had COVID-19, recovered, and now want their job back and can't get it, and playing a role in advocacy with that. Financial problems, visas extensions for immigrants who can't go home or they have a sick person here, so we're continuing that. Domestic violence, you're sheltered in place. I don't know about you, but it's very new living conditions for all of us. So think about domestic violence issues that might occur, or elder abuse issues. And there was one other one I thought of, special ed. I've heard from a lot of, through our special ed folks that, for example, kids who used to get services in their home can't get those services anymore, and home care as well, lots of home care issues. So I think with that, I can stop, because I know we're short of time.
Great. Thank you so much to all of our speakers. And I'll turn it back over to Ellen.
Great, and thank you, Mallory, for stepping in and doing a beautiful facilitation job, and to all of our speakers. And actually, I think a testament to the content that you were all covering. We didn't get a ton of questions in the chat box. We've got a couple, and so I want to throw it out actually to all of the MLP panelists, because I think you might each have, you've touched on this a little bit, but we got a question. What advice do you have for MLPs that were actually set to launch this year? There are certainly many out in the field, and they were just getting going, or they're just standing up their program. Thoughts, Keegan, Mallory, Randye, about how to think about that?
Why don't we go ahead and start with Keegan, and then Randye, and if I have anything else to add, I will.
Great. Keegan?
Yeah, I mean, I think I would just reiterate that this really is an excellent time to think through the very broad question of social determinants of health, and how you can, and have, without subverting in-house counsel, but how you have a different perspective and a different opportunity, even if you're not able to offer on-site services related to individual social needs. It's a tricky balance, though, right? Because our medical partners are so busy doing very real life-saving work. But that is really the opportunity that I see most broadly, is thinking very broadly about how organizationally can we partner to address patient and community needs.
Did you want me to? Yeah, I think it's a hard time. I mean, I think we were just talking about this today at our team meeting, that, after Corona, after the virus, we are going to have to regroup and start again almost, it feels like. So I think it's probably a difficult time, but I'm sure there's other roles that people can play. And if there isn't, well, I have a question when all the other questions are done. So.
Great.
The only thing I would add is to maybe potentially focus on the medium term. And if you find yourself with time, think through how you would serve your new partners in the medium term, and try and be kind of shovel ready for that to happen once the immediate crisis has passed.
And I'll throw in, this is Ellen, I'll just throw in too on that score. Don't be afraid to talk to your funders in a really candid way, and reset or realign expectations about what it is that you're going to accomplish, and be as flexible as you can be, and ask them to be flexible. There's a huge movement. I think some of you touched on it, Keegan, you certainly did, about funders who recognize that this is a unique time, and there are going to be unique needs. And so we have a place and a role to play through MLP, and that this is an opportunity to maybe realign some of those expectations. So, yeah. I just two more questions that came in, but I think folks have kind of covered it, but just to give you sort of a round robin for wrap up. Another question is talking about effective communication methods that you might be thinking about or planning for in terms of doing client education, right? And some of you touched on that. And are there at the network level, or any of you in your different MLP roles thinking about client education opportunities, maybe more medium term, Mallory, as you said, but that was a question that came in.
Okay, why don't we start with Randye, and then Keegan, and then our colleagues at Network.
Well, haven't even gotten there yet, in terms of, but we still have other clients. For example, we used to do a lot of cancer webinars for people with cancer and know your rights. And I think that as things develop, there will be many opportunities to do education of our clients around workplace issues. There are so many new workplace issues that I think we would do. And I think we just have to figure out new ways of doing outreach. I don't know how we're going to necessarily, how we'll find them at this point. But I think we will work on that. And I think that's a great way to use our time. If our healthcare professionals we can't educate them now because they're so busy. Let's educate our community that we're serving.
Thank you. And Keegan?
So one resource that I think every state has is a LawHealth website. I know that we have here in Texas, texaslawhealth.org, and it is a web-based attempt to educate and to provide legal information, legal forms, documents for people at large in the community. And so our legal partner is our state support agency, and they run that. So we have in the past and will continue to provide that kind of population health perspective to the development of those resources. So we have a dedicated COVID-19 response page that provides with legal information and social information. This isn't necessarily what the MLP itself is doing. We have a different department that does that, but we're lending our what we're hearing with our ears to the ground from our medical partners in order to facilitate or help them help the experts develop those pages. So I know that's one opportunity that we have found, putting both social resources and legal resources in one place that is really community oriented. And then we are hoping to put together something similar for advocates, because we have found that as we're trying to understand all of the changes that are happening, which court is closed and what there's a moratorium on and for how long, is that I think there's an opportunity also to do that on an advocate level, and we're hoping that our state MLP coalition will kind of take the lead on making sure that Texas advocates have that information as well.
Great.
Thank you,
I'm going to bust in because. Thank you, Keegan. I'm going to bust in, sorry, Mallory, because we do have a couple more questions coming in through the chat, if that's okay. And one very specific one, which is, can a doctor engaged in a telemedicine conference invite an attorney to join? Sounds like a law school question to me. Maybe it's something for the network folk to comment on, and maybe that's, merits a follow-up, but if anybody has a gut response on that.
So is this too easy of an answer with consent?
Yeah, I was going to say, unless there's a HIPAA issue, it would be the same way you would do it in a normal situation.
There you go. I love that.
And actually, one of the issues to think about from next is some of the ethical issues that have come up in this last few weeks.
Right. And I know you're thinking about that, public health folks on some of those dynamics too. So maybe that's a follow-up, right? And then we had a question that I think we sort of tackled, but it came in through the chat, which is that the hospital where I have an MLP is only allowing individuals to enter if they have an appointment. How do you recommend continuing to get my MLP central intake line out to people if they can't see it at the hospital? But again, you guys have all contributed your strategies around managing expectations and focusing where you can and sort of realigning your work. But I don't know if you have anything to add there.
I wonder, is it possible to have a message go out like through the patient portal where at your medical partner? Maybe they wouldn't be willing to put those resources in, but I think it's one of our partners. If we said, hey, we want to send something out, we've used it in the past to send out information about public charge, for instance, and so that may be one way to still connect with your potential clients.
For example, when we moved to our centralized system for the public hospital system, it went out through their intranet. So that's what we're using. Whatever system the hospital uses to let the word out about anything they have to share, we're going through those systems.
Great, thanks for that. Another question, and if your community doesn't already have an established MLP, is there a roadmap to establishing one or modified version of standing one up rapidly? And I think for me, the best response is always focusing. I always direct people to the case study in Texas that we did with Keegan's team at Austin People's Community Clinic, because it has a beautiful timeline that talks about how long it takes to stand up an MLP. But that's not to say that you can't stand up a connection and a relationship in fairly short order. But I think undertaking, as we had said earlier, undertaking an MLP in this environment is pretty heavy lifting given what our health partners are confronting. Can I get an amen from the panel?
Yeah. And Ellen, I would also just direct people generally to the National Center for Medical Legal Partnerships website. There's a lot of resources up there. Yeah. And then also the
those guys are great.
MLP, the VA MLP Readiness Guide, though it was produced specifically for the VA setting, has a lot of material in it that is generally applicable regardless of healthcare site. So, but I fully agree that with probably a very few exceptions, like now is probably not a great time to try and stand up an MLP because you need to engage with leadership and they're just not available right now.
Okay, with that, we're heading into 2:15, and we really appreciate so much, first, our panelists, our experts that brought their insights and expertise and support to this conversation, and we hit our max, so some people weren't able to join us, but this is was recorded. It's going to be available on our website. Please keep pinging us with questions and resources and your own innovations and linkages out in your communities, and we'll do our best to update our resources, share them with our partners on the call here and out in the world. And please stay safe out there. So I think with that, we're going to close it out, and I thank everyone. Okay.
Thank you.
Take care, everybody. Bye, Keegan.
Bye.